It may differ between certain individuals, but there are general features that we look at. So firstly, we can look at the golden proportion of the face, where we split the face into facial thirds, and also the length to the width ratio of the face. We can also look at the E-line, which is a line drawn from the tip of the nose to the chin, and see whether the lips lie on it. We can also look at not just the color of the teeth, but the shape, the symmetry, and the position of the teeth and gums in relation to the face. Slimmer lower face would also add to the attractiveness of the facial features.
The first thing that starts is that we start losing collagen. The skin gets thinner, you lose the plumpness and the moisture in your skin, and you start getting wrinkles. Your teeth start getting yellower, start getting flatter, because after years of use, your teeth get shorter and shorter. Your teeth also may start moving, especially if you're a cleanser or grinder. The lower face actually starts to shorten. When you lose lower facial height, that's when a lot of aesthetic problems come in. Your skin starts to fold downwards, your jaw gets very square, and you start looking a lot older. Your neck also starts getting a lot of wrinkles. But we also get functional issues as we age, because as your teeth get worn out, we lose the grip when you eat. And as we grind our teeth and our face becomes shorter, we put a lot of pressure on the joints, so you start getting joint issues called TMJ issues, because you lose that support from your front teeth.
For some of us, we may have hereditary traits that may lead to discrepancies in facial structure. For this group of people, they have physical changes that tend to be more prominent as they grow up. If they have genetic tendencies, then you will see these changes a bit more during puberty. When people have an underbite like this, it may even lead to things like crossbites, where the lower teeth covers the upper teeth, and in severe cases, they may also have chewing problems. In people with an overbite problem, because their lower jaw is so narrow and so small, the tongue may not have enough space, it may be crammed up, it may fall backwards and therefore block the airway. So as a parent, if you notice that your child has a tendency to grow in a certain way, for example, either the upper or the lower jaw being too big or too small, then it will be good to bring your child in so that we can do an assessment and do growth modulation if necessary. Use appliances just before or during the pubertal growth spurt to help shape the child's facial bones. This helps to enhance aesthetics as well as their function. By doing growth modulation at an appropriate time, we may be able to minimize the chances that the person may require extensive jaw surgery in the future.
Traditionally, a smile makeover uses cosmetic dentistry like teeth whitening, crowns, veneers to create a better smile. However, with Dento Facial Esthetics, we combine the use of cosmetic dentistry and aesthetic medicine, for example, orthodontic surgery, Botox, or injectable fillers to ensure that the smile matches your facial features and vice versa.
Sometimes we get patients who come in with an avulsed tooth after a fall or an accident. We tend to replace a tooth for a tooth. So basically, we use dental implants to restore the patient's dentition or the missing tooth. A dental implant is a surgical procedure where the implant is surgically placed into the jawbone. In some instances where implants is not desired by the patient or because of medical conditions, and then we tend to use other prosthetic options like 3-unit bridge into that area. The option to protect the tooth from breakage would be the option of crowns and bridges or veneers. Say if you have a missing tooth in the middle and you have 2 existing teeth over there, we will use a dental implant to replace the missing tooth that's right in the middle. We need to replace teeth for a variety of reasons, not only for aesthetics but also for function in terms of mastication. It also affects speech.
We use this very standard formula called FDGO. F means facial. When we are evaluating you, we're looking at which part is the issue. Is it a bone issue? Is it a soft tissue issue, which is like maybe your skin, or the outer surface of your skin? If there are aesthetic issues because of bone issues, say like you're class 2 or class 3, Then we have to do facial surgery, we call orthodontic surgery, to move the bone structure around so that the bone can be shaped and put in a better position. If your chin is an issue, we can actually put in implants, or we can actually cut the chin to put it back. Those are called genioplasty procedures. If it's a soft tissue issue, say for wrinkles, we can actually use Botox. So Botox actually paralyzes the muscles so that it's not able to crinkle. Fillers actually fill up troughs or depressions in the areas. The other issue with aging is that when you grind too much, your muscle here actually becomes too square. Can give Botox into this muscle area to help it relax so you don't look so tense. And of course, with aging, when we get pigmentation or your skin pores start to get bigger, we can also use lasers to actually smoothen the skin and make it more radiant and bouncy.
D is for dental, where we can use teeth whitening, crowns, veneers to change the shape, the size, the position, and the color of the teeth to match the overall face.
G is for gums, and we can actually also do plastic surgery on your gums to reduce a gummy smile by making your teeth longer, or we can also pull your gums down so your teeth are not that long.
O is for occlusion, when we can use full mouth crowns to open the bite, to increase the lower face height, and to reduce the drooping of the face.
Or we can use braces to actually move teeth that have gone out of position and prop your face up into the original position. So there are lots of ways that we can do to restore what has been lost or to preserve what's still existing.
If we catch it at a good time, we can do growth modulation for the child, and this actually helps to reduce the complexity of future orthodontic need.
There are many procedures available nowadays, like injectable fillers or Botox, that can help to mask mild soft tissues or skeletal problems.
Now with science and technology, we can actually use Botox, fillers, surgical methods to actually enhance our appearance on the outside. So our motto, as within so without, actually represents what's on the inside. Your inner thoughts and your biochemistry is actually going to be expressed on the outside. So no, I think it works hand in hand and it's absolutely not incongruent. I think that's what dental facial aesthetics is all about.